Thank you, Mr. Pasquale. Dr. Wenstrup, you're recognized.
Thank you, Madam Chair. Mr. Secretary, good to see you today. Thank you for being here. I want to comment on a few things. You know, I hear a lot today about how more people have health insurance and all that, and I think that's a wonderful thing, but it doesn't always relate to health. It doesn't always relate to great outcomes. You know, as a physician, you know, often insurance companies, CMS, it doesn't matter who, they'll deny coverage, they'll deny or delay care. Sometimes they'll limit what you can do in an effort to prevent things. And we have some bipartisan efforts to try and reduce that and to make things better. And I was also appreciated your concern about the nursing homes, but what we failed to mention today is what happened in New York and some other states. You know, I treat a lot of infections. You quarantine people that are highly contagious. You don't take them and put them into a nursing home with the most vulnerable people that are going to die from that particular contagious infection. And that is exactly what happened. And it wasn't consistent with CMS guidelines. And we need HHS to be more outspoken on what happened here so we don't let this happen again. So those numbers are astronomical, but many of them were very avoidable. So I appreciate your concern there. I don't know where you stood on vaccine mandates, but you want to talk about confusing and aggravating the American people. It's you need to get this or you lose your job, which is not real good bedside manner, I might add. But it took away the doctor-patient relationship. We can't let that happen. Patients deserve the opportunity to talk to their doctor about what the vaccine is about, and what the potential side effects are, what the benefits may be. I'm vaccinated and I got COVID, and I was out vaccinating people. You know, I understand the benefits, so I'm not anti-vax. I'm just saying, you know, that was a problem. But at the same time, what America saw, people coming across the border by the thousands, by the hundreds of thousands, not being tested and not being vaccinated. Yet other people in America, hardworking people, were put under that same pressure. It didn't make sense. We got to be consistent with what we say and what we do, and we need HHS to lead on that in many ways. It created a lot of confusions. Listen, I want to thank you for spending time with the Doctors Caucus. I think we need to do more, either you or some of the senior leaders, because we have a lot of things we can do on a bipartisan basis to make things better. We need to be embracing the health of America, not just because you have an insurance plan. We need to embrace health, overall, education in health of our youth. Do they know what healthy foods are? You know, these are all the things that we can be doing and doing things that are preventive, actions that result in better health of America. I keep saying I want us to be the healthiest nation on the planet. And it's not just having an insurance plan that gets you there. There's so many things that we have to do. And you know, health and human services. Are our human services giving us a return on the investment? Are we creating healthier humans through the things that we are doing? That's the real question that we have to ask ourselves. We can talk about this plan, that plan. You know, I saw with TANF written down that they said that one of their missions is to prevent out-of-wedlock births. Prevent out-of-wedlock births. What are we, China? How come we aren't talking more in there about promoting healthy mothers and healthy children, which, by the way, we did through the McVie bill that we passed, bipartisan, and was signed into law by the president. Let's start recognizing the value of the healthy human life and go in that direction. So yeah, I'm taking this opportunity for messaging. That is what I'm doing. And I'm sharing with you the things that have people scratching their heads out there, right? But I will get to one other thing that you're probably expecting from me when it has to do with the No Surprises Act. And, you know, with federal court in 23 invalidated some of the HHS regulations, and I'll get right to the point. In January 12, 2024, the department decided to withdraw its appeal regarding several important parts of the court's ruling, which, one, prohibited insurers from using any out-of-specialty rates, and two, using the rates of other self-funded plans in calculating QPAs. You know what I'm talking about. And it's been more than 2 months since that decision, yet we haven't really seen any guidance instructing on that. Maybe it's been out there, I haven't seen it. We need to be instructing insurers and IDRs to follow the law. And I just want to know, when will the department be issuing that update?
Congressman, we are, as you know, we're undertaking some audits on how those QPAs are being applied, what's underlying them, and I'm hoping that pretty soon, whether it's at the Doctor's Caucus or in another hearing, we'll have some information to provide you. In fact, because there's so many of these audits that we're doing, we'll probably start to post them as quickly as they start to come out online so people could start to see them. But we're hoping that this informs everyone on what is expected when we talk about these QPAs, because we want to make sure that we don't have the issuers, the insurers, using a wrong foundation for which to, market, or excuse me, to price the service. And so these audits will be very important, and we'll stay in touch with you on that.
Please do. That'd be very helpful every step of the way. Thank you. You're back.